Portfolio Committee on Health has announced that public consultation on the new tobacco products and electronic delivery system control bill will end on the 28th of July. The bill aims to regulate not only traditional tobacco smoking, but also electronic cigarettes such as vapes, which have become immensely popular in South Africa. To get the perspective on vapers now, or of vapers, we're joined by Asanda Gcoyi, CEO of the Vaping Products Association of South Africa. Thank you very much, Asanda, for your time this afternoon. You're not quite convinced that vaping is understood in South Africa. Why?
Thank you, Didi, for this opportunity. Yes, vaping is not as understood as we'd like it to be. And the reason why we say that is you just need to look at the current bill that is with the Portfolio Committee on Health to really understand that the misconceptions and misinformation on vaping have gone as far as informing a policy that is not properly captured, in our opinion.
What are some of the misconceptions that you want to address?
I think the base fundamental of vaping is that we need to understand that vaping and smoking are not the same. And when you take that as your point of departure, you will realize that what we're speaking about here is a risk proportionate regulation, where we are comparing smoking and vaping, and we realize and acknowledge, based on scientific evidence, that vaping is indeed less harmful than smoking. And if that is your point of departure, then obviously the way you propose it gets regulated ought to be different to the regulations that will govern smoking. But currently this bill seeks to regulate both products in the same way, which does not make sense at all.
And so what options are then available? I mean, have you presented the scientific research to the various or relevant authorities, and what was the level of engagement?
I think when you look at where we are, Juju, right now in the legislative process, you'd understand that the custodians of this bill is the Department of Health. And from as far back as 2018, the industry has always sought opportunities to engage meaningfully with the Department of Health and to provide them with scientific evidence that is contrary to the evidence that they're relying on. However, all our efforts were met with, we do not engage with the industry. And as such, you look at this bill and you can tell that this is a department that has not sought to understand an industry that they want to regulate. So we are hoping right now that with Parliament, the industry will have a chance to present this scientific evidence. And it's not scientific evidence that is coming from the industry, but leading key opinion leaders in tobacco harm reduction that have found time and again that there is enough evidence to compel regulators to regulate the industry in a different manner.
What are we seeing elsewhere in the world?
We've got two extremes, Dudu. You've got demographic. We've got rather geographies that have opted to go the deny access to these products. And then you've got other locations that have decided to be more permissive. And when you look at those that are more permissive, you will see that their public health policy is underscored by the concept of tobacco harm reduction, where they've said that we do understand that smokers are addicted to nicotine. However, what kills them is the combustion. So how do we provide nicotine to these smokers who, one, either do not want to quit their addiction or are unable to? And vaping is proving to be one of the leading smoking cessation tools in helping those individuals to wean off of their tobacco addiction. So I think it's important that you learn from places that are doing it correctly, because they've seen the number of smokers in their specific countries drop drastically. However, in South Africa, we've seen that the numbers of smokers is actually increasing, which is quite worrying. And we are not looking at what other options are available to decrease the smoking prevalence in the country.
Asanda Gcoyi is the CEO of the Vaping Products Association of South Africa. Thank you very much for your time this afternoon.